Okay, so welcome everybody. Hopefully you can hear us. Thanks for joining our webinar today. We're going to be discussing HIPAA privacy, especially after the recent regulations have been released. We're going to start with some introductions and then dive right into the presentation. So thanks for joining us. My name is Brad Howden, CEO of HIC Network Security Solutions, and with me today is Mike Lardiere, who's Vice President for National Council for Community Behavioral Healthcare. HIC is a leading provider of network security solutions. We've been around since 2006. We have a team of high-end engineers. We work with lots of companies in the healthcare vertical as well as financial, dealing with compliance issues, regulations, and risk assessments, analysis, and audits. And Mike, I'll let you introduce yourself here.
Thanks, Brad, and good afternoon, everyone. And thanks, Brad, for inviting me to present with you today on this very important topic. As Brad indicated, I'm Vice President for Health Information Technology and Strategic Development at the National Council for Behavioral Health. We just recently changed our name to the National Council for Behavioral Health. And in this capacity, I work on educating providers and providing training and technical assistance around all things HIT. HIPAA with the new regs is a focus of ours right now. 42 CFR, which is a substance abuse regulation. Also work on assisting behavioral health organizations to implement health information technology, and also a leader in health information exchange and the sharing of physical and behavioral health care. And so with that, I think that's enough about me for now, Brad, and turn it back to you.
All right, sure. So thanks, Mike. That was a great introduction there. In addition to discussing the impact of HIPAA's new privacy rules, we're also going to be discussing some real-world techniques and solutions that can help mitigate the risk associated with data breaches. How to prevent data breaches, identify that they've happened as they're happening and after the fact, as well as how to clean up after a breach has occurred. And with that in mind, we're going to go through some quick facts on the next slide, and just to provide some context for this presentation. So, over the past few months, healthcare providers have been experiencing dramatic increases in malicious activity. In 2012, healthcare entities accounted for the largest percentage of data breaches, and that ranged between 30 and 40% of all breaches quarter over quarter. And that information was based on surveys done by Navigant last year, and PHI has been a big target of this hacking activity. So, personally identifiable information and protected healthcare information contains things like social security numbers, names, addresses, birth dates. All that information can be used by hackers to commit identity theft, wire fraud, electronic check processing, or ACH type payments and fraud. The danger of this is that it costs it's a real pain to, once you've been hacked or once somebody has stolen your identity, it's a big challenge to get things cleaned up on an individual level, and for organizations that inadvertently supplied that information, there could be severe penalties in terms of financial penalties, as well as damage to their reputations and other collateral damage. So next slide, we'll go through some additional information. So hackers are extremely clever. They're well paid. Hacking, especially when it comes to personally identifiable information or PHI, pays better than drug dealing at this point. Per incident, it's over $400. And hackers are clever. They're well funded, in some cases by governments. Healthcare entities that have never before considered themselves at risk are now high-value targets, regardless of any intellectual property that they have. Just the information on individuals that they have is enough for somebody to create multiple credit cards and execute tons of fraud in terms of financial transactions. So in over 50% of the breaches, and this is for 2012, hacking and theft were the top methods used. And according to the FBI, in just about every case, there were early warnings in the event logs indicating their breach was imminent. And we'll go through an example on the next slide of what this looks like. So what we're seeing here is several different events that have occurred within a short period of time, or even over a long period of time. So there's devices that can take a look at the logs for certain patterns of events that occur within minutes or days. There's others that provide context for incoming log events over the course of months or even years. And what we're seeing here is that a particular user is connected to a device in a country that's that you have no business connecting to. He's connecting from an unusual device, or maybe he's connecting to a blacklisted IP address. And all of these events by themselves are not very meaningful, but together they indicate that there's something anomalous going on and that it needs to be looked into. So this is just a quick example. Other examples may be a user that's logged in from multiple locations or from multiple devices at the same time, and especially if those devices are not local. In other words, somebody could be logged in through an iPhone and their laptop to the network at the same time. But if somebody's logging in remotely and at the same time they're connected locally at the office, that could be a potential issue. Either they're sharing their user account or their credentials have been compromised. And we'll be going through some technologies during the course of this presentation that help identify that kind of stuff and react to it in terms of incident response. So at this point, I'll turn it back over to Mike, and we'll get started with the presentation.
Great, thanks, Brad. And I believe if folks have questions, they can use the question box over on the right, and we'll try to answer them. There is a lot of information here, so we're going to go quickly, and the presentation will be available to you later on. You'll get a link with the presentation, so you'll be able to review it. I'm going to first identify some of the data breach incidents and responses from a survey by the Society of Corporate Compliance and Ethics. Next slide. So we know 45% of the responses to responders to this survey had more than one breach during the year. So many organizations are having multiple breaches. So that's an important item for folks to know. Next slide. And the cost of some of these, the cost of the breaches are less than $50,000, but a large percent of them move up to between $50,000 and $100,000 and $100,000 to $250,000. I think the point here is, you don't want to take the risk of having a small breach because who knows if the breach is actually going to be small and cost you less than $50,000, where many of them get up to the $100,000 to $250,000 number. Next slide. So it's important to recognize that the new HIPAA regulation changes, and all covered entities and their business associates now need to comply with the HIPAA regulations. Prior to these regulations being updated, business associates were not held to the same standard. Now they are. So in order to identify if you're a covered entity, are you a provider? Are you a Medicare Part D plan? Are you a hospital? Are you a clearinghouse or an HMO, insurer or payer? You would be a covered entity, a CE, as you'll see in the rest of the presentation. Next slide. So you look to determine your starting point. Do you electronically engage in any of the following transactions? If you electronically send information about eligibility, billing, invoices, enrollment, or other, you're a covered entity. So you need to look at your business and see, has your business changed over the last couple of years? And as I mentioned, business associates are now directly subject to the security rule. Next slide. So within this presentation that you'll download later on. This chart helps you go through the process of identifying if you are a business associate or not. It's very important that you take a look at this, because the HIPAA security rule just doesn't apply anymore to just medical providers or healthcare providers. It really also applies to people who are doing business with healthcare providers. So you need to look at your book of business, see if you're doing business with healthcare providers, hospitals, home health agencies, clinics, any type of healthcare provider, to see whether you are now responsible to comply with the new law. Next slide. So there are two pieces of this. There's the high-tech privacy and security components, which updated the HIPAA rules. So it addresses business associates, marketing and fundraising, sale of protected health information, PHI, the right to request restrictions on the part of us, you, me, as patients, and electronic access. And there's also high-tech enforcement and other modifications around research, notice of privacy protections, decedents, and student immunizations. And we'll run through much of this in the presentation today. Next slide. So there are some important dates to remember. So the most important date on this slide is the compliance date, which is September 23rd, 2013. And there is some transition period. So if you're not compliant now, you do have some time to get there. But anything that occurs after September 23rd, 2013, you will be held responsible for. Next slide. So we'll go into some of the prohibited disclosures. There are prohibited disclosures on genetic information for underwriting purposes. So they can't use genetic information to increase your insurance premiums. And there are also prohibited disclosures on the sale of protected health information. Next slide. The rule expressly provides that genetic information is protected health information, and it prohibits the use or disclosure of that information for underwriting purposes. And the terms and definitions in the rule track the regulations that are prohibiting discrimination in health coverage based on genetic information. Next slide. Even where a disclosure is permitted, covered entity is prohibited from disclosing protected health information in exchange for remuneration. So you can't sell information without a client knowing about that, a patient knowing about that. And it includes remuneration received directly or indirectly from the recipient. And it's not limited to financial remuneration, so there may either be goods and services that would count as remuneration. If an authorization is obtained, the authorization must state that the disclosure will result in remuneration. Excuse me, hard to say sometimes. Next slide. There are some exceptions. So there are exceptions around treatment and payment, when there's a sale of a business, remuneration for business associates for services rendered, disclosures required by law, providing access or accounting to an individual for public health reasons, for research if it's limited to the cost to prepare and transmit the protected health information, and other disclosures where only the cost of preparing and transmitting the protected health information is allowed. Next slide. So there are other authorizations that are now required for marketing and research. Next slide. So under marketing, communications about health-related products and services by a covered entity or a business associate to individuals now marketing and require authorization if paid for by a third party. So if you're an intermediary and someone is paying you, you're a covered entity, and someone is paying you for marketing activity, there are now restrictions on that. This applies to receipt of financial remuneration only, and this one doesn't include receipts of non-financial benefits. The authorization must state that the communication is paid for, and the authorization can be obtained to make subsidized communications generally. So the scope of the authorization does not need to be limited to a single product or service, or products of services of one third party. So a company may have multiple products and services, and you can use one authorization to cover those that marketing activity. Next slide. So as I go through this, you'll see that if you have old authorizations and you haven't updated your consent release information, you're going to need to do that. Marketing is also limited for, with the exception for refill reminders and similar communications, including generic equivalents, adherence communications. So if you are marketing to clients to adhere, patients to adhere to medications, there are limited exceptions for those, and payment must be reasonably related to the cost of the communication. So if you have a mailing of 5,000 clients and it costs you $10,000 to do that, you're not going to be able to receive $100,000 for it. And face-to-face marketing communications and promotional gifts of nominal value are still permitted without an authorization. Next slide. If you're doing research, compound authorizations are now permitted. So it expands the research opportunities under the new regulation. So a single authorization form is permitted to use or disclose PHI for conditioned or unconditioned research activities, but it has to have a clear opt-in. It needs to be voluntary. The flexibility permitted on ways to differentiate the components of the research project. It also includes future authorizations, and it aligns with the common rule for informed consent requirements. Next slide. Under student immunizations, the CE, the covered entity, may disclose now proof of immunization of a child to schools in states with school entry laws with oral or written agreement of the parent. So you still have to have the oral or written agreement of the parent, but you can now submit that immunization information. Decedents. Decedents is information is no longer protected health information after a 50-year period. The previous law didn't identify an end date to that. So if you have that information for 50 years, you don't have to keep it for 50 years, but if you have it for 50 years, then it's no longer PHI after that. And you may now disclose, this is new, you may now disclose decedents' protected health information to family members and others involved in care or payment for care of a decedent prior to death, unless it's inconsistent with their expressed preference. Next slide. There are now other requirements under fundraising. Next slide. So the covered entity may use additional information to target fundraising communications. So you can use demographic information, dates of service. You can now identify that the client, the patient, was in a specific department or they receive of service. They may have been in a cardiology unit, for example. You can identify that they were treated by a specific physician, or they had a specific outcome, and health insurance status. Next slide. Each communication to the individual must include a clear and conspicuous, has to be clear and conspicuous opt-out. So, and there cannot be any undue burden or more than a nominal cost to exercise your opt-out requirement. The covered entity may not condition treatment or payment on an individual's decision to opt out. You must honor opt-out, and no further fundraising communications would be permitted. And there is some flexibility provided in the scope of opt-out method to opt back in, which is permitted. Next slide. There are now new required inclusions and new distribution requirements. Next slide. So the content of your Notice of Privacy Practices, NPP, you'll see later on in the presentation. So your Notice of Privacy Practices, the content must now include statements regarding the sale of PHI, marketing, and other purposes that require authorization. So you need to update your Notice of Privacy Practices. For covered entities engaging in fundraising, you need to have a statement that an individual can opt out of fundraising communications. For providers, need to have a statement that the covered entity must agree to restrict disclosure to a health plan if the individual pays out of pocket in full for their healthcare services. So a patient can now say to a provider, I'm going to pay for all these services out of pocket, and I do not want you to send that information to my health plan. And you as a provider must now have a mechanism in place to ensure that that information does not go to the health plan. You need to now have in your Notice of Privacy Practices a statement about individuals' right to receive breach notifications. And for plans that underwrite, there needs to be a statement that genetic information may not be used for underwriting purposes. Next slide. Now, health plans may distribute material revised in their Notice of Privacy Practices by posting on a website by the effective date of a change and including in the next annual mailing to individuals. So if you're making changes mid-year, you can just post that on the website, but then in your next annual mailing, you have to identify that. And then you can also mail to individuals within 60 days of the material revision. Next slide. And you, me, as patients, we now have a right to request restrictions, and there are new requirements around restrictions. Next slide. So a covered entity must agree to an individual's request to restrict disclosure of protected health information to a health plan if the protected health information pertains solely to health care which the individual has paid for, paid the covered entity in full out of pocket, and disclosure is not required by other law. So if there's some other law that says that you do need to disclose that information, well, then you can disclose the information. Next slide. The preamble provides guidance on the scope of the restriction. So the restriction extends to healthcare items or service paid for out of pocket. There's a restriction on follow-up care. So the individual must pay out of pocket and request restriction for the follow-up care. So every time the client comes in, they do have to request that when they make that payment. And there's also restriction on downstream providers. So the individual has the obligation to request the restriction from downstream providers, but providers are encouraged to really assist. So if a patient comes into you, does not invokes their restriction, you're supposed to help when you send the information to another provider that you're providing a consultation to or requesting a consultation from for that specific disorder, the reason the patient came in. You're not bound to do that, but the spirit of the law is you should assist the patient to do that, but it's really the patient's responsibility to request all providers to honor that restriction. Next slide. There are now issues around electronic access, and designated third parties. Next slide. Thank you. So individuals can now request an e-copy of their PHI, and that should be provided to them in a designated record set. The covered entity must provide access in an electronic form or format requested, and that's if it's readily producible. Otherwise, it needs to be provided in a readable electronic format as agreed to by the covered entity and the individual. So if the individual brings you a, in quotes, normal medium, a CD or a flash drive, you should be able to give that to the person on the CD or the flash drive, make a copy of it for them there. If for some reason they bring in a medium that you just don't have the capability to produce, well, then you can come to an agreement to provide the individual a copy in a otherwise human readable form. You must be able to produce some form of e-copy of the record, and you can provide a hard copy if the individual declines to accept any of the electronic formats that you provide as a covered entity. So you still have that flexibility to not have to do some out of ordinary media or use an out of ordinary media. Next slide. So there is new components of the HIPAA security rule around secure delivery. So most healthcare organizations are using some form of secure electronic delivery to distribute electronic documents to individuals. The process of secure delivery needs to be monitored and enforced. There are certainly several types of technologies that can facilitate this. Email platforms provide for encrypted delivery of PHI, even if it was originally sent unencrypted, and incident response systems verify that no PHI is sent out unencrypted. So there are those capabilities. And
so Mike,
Brad,
if I can, jump into a couple real-world examples here.
Mm-hmm.
We were working with a hospital system, and they were doing an evaluation of a new email platform for security purposes. And what was interesting is that their emergency room actually had some service level agreements in place regarding how soon patients need to be treated, and if for some reason they exceeded those thresholds, there were some penalties that would kick in. So two of the nurses apparently, at the end of this evaluation they did, we ran some reports, and it turned out that we did a couple top 10 reports, like top 10 senders, top 10 recipients, and within both reports, there were a couple of nurses and two law firms that kept showing up. It turned out that over a 2-year span, these nurses were actually sending patient information to these law firms and unencrypted regarding when SLAs were breached or exceeded. And the law firms were initiating lawsuits on behalf of these patients. So that, in terms of the lawsuits, it cost those hospital several hundred thousands of dollars over a 2-year period of time. They were able to not only recoup that money, but also get additional dollars back because it was fraud. So you can basically get triple the award back in that case. So without that system in place, they would have had no idea, and they would have continued to bleed money. And for most emergencies rooms that operate at almost a break-even cash flow, that's a major concern. In terms of email access to PHI data, sending it out via email, some of the incident response systems are good enforcement points, so they can actually determine whether or not personally identifiable information or PHI was sent out unencrypted. And where that's important is, we had an organization that was rearranging or doing some reorganization in terms of their email flow, and for a 4-hour period of time, their encryption appliance got bypassed. Now they have 80,000 individuals that could potentially have been impacted by that. Fortunately, there were only 4 people that had information sent out unencrypted, and they were able to notify those people right away. In each case, for each individual where their information's been distributed unencrypted, it's at least a cost of $50 per individual. So this organization had a potential of 80,000 people, or a minimum of $4 million that they would have been liable to pay out if they didn't have this system in place. So the system basically paid for itself multiple times during that 4-hour window of time, and that was approximately 4 weeks after they had put it in place. So in terms of companies that make these type of solutions, you've got Solera, RSA, and Proofpoint are probably the top 3. A lot of healthcare organizations also leverage Zix for email encryption and anti-spam, that kind of thing as well. But the point is that there's a lot of systems that can automate this process and enforce this process and save time and money at the same time. Next slide.
Great. Thanks, Brad.
So
and that's
hand it back to Mike here.
Yep, that's a really good example of what was happening there at the hospital. Okay, so back to electronic access. The covered entity may charge for electronic access if a patient asks for information, but it's really for the labor for copying. So time attributed to reviewing the request and producing the copy, and the cost of electronic media. And you have up to 30 days to provide that. Next slide. If requested, the covered entity may transmit a copy of the PHI to the individual's designee, and it's not limited to electronic access. The request must be in writing and signed, and it must clearly identify the designated person and where to send it. Next slide. So practically speaking now, when you're looking at uses and disclosures, there are some internal issues that you need to begin to address with this new HIPAA regulation, with the final rule. You need to look at job descriptions. You need to look at policies and procedures. There's the issue of risk analysis and risk assessment. External businesses or your business associates agreements, and your patient-facing, some of the notice of privacy practices that we spoke about. So we'll go into those in a little bit now. Next slide. So for job descriptions, you need now to review your job descriptions and make sure that the job description matches the access allowed to your protected health information. So now you need to begin to review those job descriptions and identify which ones are allowed to see what, which types of jobs are allowed to see what types of information. So do all your members of your staff need full access to all PHI? Probably not. Now you need to update a job description so that if you're in this job description or this role, you only have access to this type of PHI. You need to consider whether they can view only, whether they can add only, or they have control for full access to that particular staff. So job descriptions are becoming important to update those now. Next slide. You need to have internal documentation and policies and procedures. You need to begin to align your desk procedures with your company policies. You may have more than one procedure for a given policy, and that's not necessarily good. So you need to align those policies for those procedures. Help your staff know the consequences for non-compliance with the procedure. Some of this goes into staff education and your annual training with staff, but they need to know what the consequences are for non-compliance with the procedure. So do you have a procedure for providing documents to a third party? What happens when the patient requests that the records are sent via email to a third party? What are your policies and procedures on that? Do you have that now? If you don't have that now, if you do have it, you need to update it. If you don't have it, you need to put one in place now. Next slide. Next slide. There we go. You need to train all staff and when appropriate, include your training for your business associates. Remember, the business associates, your business associates, are now responsible at the same level that you are. And not all training must be formal. Once a year for the formal training, and then reminders or updates are appropriate as well. You need to keep track of who attended, when the training was provided, and what you actually trained them on. Next slide. Next slide. There we go. Thank you. In the area of risk assessment, you need to follow the data and begin to look at what type of data you have. When you go through your risk assessment process, it's one of the first things you need to do is identify what type of data you have, where it's stored, who has access, are there procedures for accessing the data, do you have audit logs, and is the data encrypted, and if not, why not? Why is that data not encrypted? Should be encrypted. Next slide.
So in terms of how to go about doing this, with some of the solutions that are available out there right now, it's important to understand that over the past couple of years, there's been a trend in terms of security spend that's shifting security spend from being 70% at the perimeter to 70% now internally. And the main reason for that is because a lot of threats are now occurring from people inside the organization, not intentionally. Maybe they go to the wrong website, their machine gets hacked, or a hacker is able to successfully breach the perimeter. But after spending literally millions of dollars on perimeter security, most organizations have figured out that at this point they can't do much more. A determined hacker is going to get through, whether it's by compromising somebody's machine or just hacking into a vulnerable system that's exposed to the internet at this point. So in terms of keeping an eye on the internal systems, really what we're talking about here is data governance, and that starts with entitlement reviews to identify who has access to what, where the critical assets are, followed by restricting access to just the people that need it, and then automating the workflow around granting privileged access to those critical assets going forward, and monitoring behavior for exceptions and violations. So for instance, in almost every case, when somebody resigns from a company, they do a massive data dump to whatever they have access to. And if they can, they'll dump it to a CD, DVD, or a USB drive. Having a way to recognize that something like that is happening in real time is extremely important. So solutions that are available for that come from Varonis, McAfee, and a few others in terms of facilitating data governance. And we can have follow-up conversations after this webinar, as needed if there's any interest in that. Back to you, Mike.
Great. Thanks. Next slide, please. All right, so now we'll talk about business associate agreements a little bit. So you need to determine who is your business associate, and you as a covered entity, you can utilize that diagram we presented at the beginning of the presentation, and that'll help you to go through the process and help your business associates go through that process. Review what is currently in your agreements regarding access, disclosure, and security. Decide what you want your business associate to handle or not handle. And remember, your deadline is 9/22 of 2014. Next slide. There we go. Your notice of privacy practices now requires language to include when an authorization is needed, a brief statement regarding the restriction of psychotherapy notes from being shared. So psychotherapy notes are never shared. They are restricted. Psychotherapy notes are different than progress notes. Progress notes is where a behavioral health provider identifies the problem, the goal, the modality, the course of treatment, and how the patient is responding to the treatment. That's a progress note. The psychotherapy note is where the provider would actually analyze the contents of what the patient is telling them. So all that analysis piece, that's never sent. And that needs a special authorization with that. So there are two components of that. And those psychotherapy notes should be sequestered in your electronic health record. The notice of privacy practice needs to include information is sent to the provider, and if that provider receives financial remuneration. So you have to tell the patient how to opt out. A statement regarding the sale of PHI, a statement when other uses not described in the notice of privacy authorization is required, a right to request a restriction that now needs to be in your privacy practice. It's not a guaranteed restriction, but they have the right to restriction. What you're going to do in a breach notification, and information on genetic information Non-Discrimination Act. All those pieces now need to be in your notice of privacy. What is an authorization and when is an authorization needed? So psychotherapy notes, research and marketing, disclosure of immunization information, and that doesn't need to be written, that could be verbal. For disclosure to a third party, so to an attorney, a medical representative, or a standalone, and a statement for other uses. If you're using the information for other uses, that needs to be identified as well. Next slide. So other uses statement would be issues around an employer and or business associates that are not involved with the treatment, payment, or operations, because HIPAA lets you share information for treatment, payment, or operations. Next slide. So under a breach, the notification needs to describe how your organization will handle a breach. Most other privacy notices didn't have that included. Now it needs to be included. And a breach doesn't necessarily mean that it's 500 patients or more, or 500 records or more. You know, a breach could be fewer than that. 500 or more, you get posted on the wall of shame, which no one wants to be on that at HHS. But the 500 rule does not mean it's not the only time you respond to a breach. There needs to be a risk assessment, and some of that is after a fact. The risk assessment is, okay, what happened? We had a breach. How did that breach occur? And you need to do some root analysis of that. And it's not a risk analysis. A risk analysis you do before the fact, as opposed to a risk assessment afterwards. Next slide.
So in terms of responding to an incident like a breach, it usually takes most organizations, if they don't have the proper solutions in place, days or weeks or even months to determine that a breach has actually occurred. It is possible, with the solutions that are available currently, to identify a breach taking place in real time, seconds after it's happened or as it's occurring. And according to the FBI, as we mentioned on one of the first slides here, in almost every case that they've investigated, there were event logs from various systems that indicated a breach was imminent or was taking place. So recognizing that a breach has occurred or is occurring requires visibility into who's doing what with the data, and the data flows between different actors on the network. So an actor might be a server, it might be a user, or other system. And there's we don't have time to drill down into the specific details of each solution during this presentation, but we're just listing out a few of the companies that make products, whether it's software or hardware-based appliances, that can either prevent breaches from occurring, identify that they are occurring, and then help with the cleanup process and validation that the system integrity has been restored after a breach occurred and the cleanup is complete. So, and some examples of this would be somebody hacks into the network and starts uploading a whole bunch of information to a server on the internet somewhere. Well, how do you know that actually happened? Some of the endpoint security, such as the antivirus, may trip off a few alarms that exploits are taking place in the box. Then you may say data flows to certain countries that you don't normally do business with. And finally, looking at incident response solutions such as Solera or NetWitness, which look at all the packets going across certain choke points, like maybe your internet connection, and to go back through those logs and actually see the individual packets to verify whether or not any kind of PHI was actually transferred out of the network. So there's a whole bunch of solutions that work together in a complementary fashion to do both the prevention, identification, and cleanup and validation of system integrity after breaches have occurred. And again, if anybody needs more information or wants to have an offline conversation about that, we're absolutely available after this webinar for those conversations to take place. So next slide.
Great. Thank you, Brad. And again, folks, the presentation will be available afterwards. We're throwing a lot at you right now and sort of quickly. And you'll get an email with a link to the presentation afterwards as well. So let's talk a little bit about the right of patients. Patients now have a right to access their PHI. They have a right to request restriction for those services paid for by the patient or a third party on behalf of the patient, and they have the right to authorize marketing communication or and also opt out of marketing communication. They also have the right to participate with the use and disclosure of the medical record. So basically, you and I as patients now can decide what we do or don't want to have done with our medical record. Next slide. So determine how you are subject to HIPAA. Some of the things we need to begin to look at as an organization is looking at how has your business changed in the last 10 years. Are you now using social media? What about smartphones? Personal health records? Email communications with members, clients, patients, consumers, whatever you call them in your organization. Do you now have a national provider number, which you may not have had 10 years ago? All these things are now subject to HIPAA considerations like we've been speaking about in your policies, job descriptions, and those kind of activities. Next slide. It's important that you know your data, know your PHI. So do you have additional sensitive information that's covered under state laws? HIPAA covers federal laws, but there may also be information that you need to comply with protecting under state laws. How will you address the PHI separately for state laws? The data flow that you look at, and you do need to do a mapping of your data flow, is may reveal very complex activities within your organization. They usually do. Healthcare is not easy. You need to locate your initial compliance documents. Where are all the forms for your PHI analyzed? Is it all spoken? Is it hard copy? Is it electronic? Is it a mix of each? So you need to begin to realize that and recognize where that is. There needs to be a balance between security and privacy, and all your departments need to be in sync. Your IT systems need to be in sync. Your legal policies need to be in sync. Your job descriptions need to be in sync. Next slide. So it's important that you review the rules and know your policies. Stay up to date on the Omnibus because the Omnibus bill changed and is built on basic privacy and security. Privacy covers 4 main types of requirements. So there are administrative requirements, uses and disclosures, individual rights, and then there are general safeguards. There are probably 50 or so topics that often say if this applies to your organization, you must have a policy and procedure around that. So it's very important that you review that or bring someone in to help you review it. Security safeguards cover 3 main areas of requirements. They're administrative, they're physical and technical, and there are 20 or so topic areas in those, and they all also come into privacy. So it's important that you double check all your policies and procedures. Next slide. So is your risk analysis current? Did you conduct an initial and then an ongoing routine risk analysis? If you've not done this as a business associate or as a covered entity, you really need to do a risk analysis. That's one of the requirements of HIPAA. You have to ensure that your risk analysis goes beyond just systems to include hard copy or spoken protected health information. How many times have you been in an elevator where two healthcare professionals are actually talking about the name of the patient in the elevator for all to hear? Can't do that. Risk analysis guidance is available at this website. This is through HHS, the Office of Civil Rights, which is the office within the Department of Health and Human Services, HHS, which governs HIPAA. And does your risk analysis include PHI documentation? The PHI flow? You need to consider the technology evolution. We spoke about social media, cloud computing, smartphones. There are fact sheets and guidance available at the Office of the National Coordinator, ONC. The Office of the National Coordinator will help to guide you through this process as well. Next slide. Need to really ensure that workforce obtains and uses only the minimum necessary information. So who's a workforce member? Anyone under your direct control, whether they're paid or unpaid. So if they're a volunteer, they need to comply. You need to make sure they know about it. Which workforce member uses data internally versus disclosure externally? Some of your staff are always interfacing. Care coordinators are also always sharing information externally. They're your voice into the community and coordinating for your patients. So they're going to be more externally focused. And you need to ensure that your policies define routine and recurring disclosures versus disclosures that occur under special circumstances. Next slide. So we talked about your notice of privacy policy. So practices, does that contain standard components do you have a standard heading? Do you have who must abide by the NPP? Again, how your organization uses and discloses PHI. You need to have a statement about your organization's right to change the NPP, and then the contact information for your organization. You can change, but you need to have a statement about that you can and will change, and then that needs to be provided to your patients in your next update. Does the notice reflect your type of organization? So the language may change. They apply to your organization for PHI now for fundraising. So that's changed. So that's an example of things changing. And you want to reinforce your entity type by using applicable examples. So in your privacy notice, you're going to put examples of what kind of entity you are. Next slide. There's a need to now review designated record sets. The individuals apply to information stored in designated record sets, and their rights apply to designated record sets. So what's a designated record set? You need to decide what's going to be your base set of data that you're going to share. You don't necessarily share everything in an electronic health record every time with all providers. That not everybody needs that information. So what's your designated record set? So you need to identify and document what constitutes that. Next slide. You need to determine a method for validation of the identity. Excuse me. What's the standard way used to validate the identity of your staff? So do you have a standard method, a standard series of questions? Do you have policy and procedures around that, including a script to identify how you're going to validate identity? Have you trained your workforce about that? And you need to be able to demonstrate in good faith that you've attempted to validate everyone's identity when they sign into your system or access protected health information. Next slide. So does the Omnibus require encryption? You want to encrypt in order to have safe harbor from having to report a breach. So if you encrypt your data and someone steals a computer, but that hard drive is encrypted, well, then you don't really. That's not a breach. It's accepted that if it's encrypted data, it's not a breach. Unencrypted email to individuals are permitted if the individuals are advised of the risk. This is a big issue nowadays. So how do we send emails back and forth between patients and providers? Well, in order to do so, first you have to advise the patient of the risk, and then you can send it. And you also need to revise policies regarding workforce members and retraining them. Next slide. There are also some other specific changes to the restrictions around documentation and identifying and tagging data elements. This is coming in the future. We're not going to spend a lot of time with that right now because we're running out of time shortly. Next slide. So with that, I'll turn it back over to Brad to answer any questions and answers. And again, we've thrown a lot at you real quick, but you'll be able to contact him more to delve deeper into these issues shortly. Brad?
All right. So if anybody has any questions, feel free to type them into the question box, and we'll answer them as they come up. Some of the questions that we typically get, especially now, is around bring your own device and cloud security. So securing cloud applications is a little bit of a challenge. Typically it's very difficult for an individual organization to do that all by themselves. And we work with a couple of different service providers that have solutions. They've got private peering relationships with most of the big cloud providers out there, such as Amazon and Microsoft. They're able to provide secure access to cloud-based applications, whether you're remote or tied directly into the local network at the corporate office or a healthcare organization. In terms of bring your own device, that's another big one that comes up all the time. Everybody's got an iPhone or an iPad or some sort of tablet or Android these days. How do you make sure that information that's retrieved from your network and servers remains secure if it's on those devices, if physicians need to share information and they want to do that over mobile devices, what applications are available to help facilitate that process so that they can communicate in real time. We've even seen some use cases for robotic surgery over the internet where the surgeons are located in a hospital that may be 50 miles away over the internet using robots in the operating room at the remote location. So, how do you go about securing all of that and effectively? And usually it requires, in terms of cloud computing, a cooperative effort with your service provider. And in terms of bring your own device, there's a couple of really good management solutions that are available that not only encrypt the data on the devices, but at the same time are able to monitor the use of that data and securely wipe those machines in the case of theft or hacking attempts and that kind of stuff. So that's thanks for joining. We definitely appreciate your time. I know you're all busy, and if there's no other questions, I'll hand it back over to Mike to address some of the common things that may come up as he's going through these presentations every day during the week, and then we will close it out.
Great, thanks, Brad. From healthcare providers, the biggest issues now are issues around the human part of it, and Many of them are still struggling with that. It's hard work to go back into your policies and procedures and make sure that you've identified that. And everyone is double checking their systems as well, because with the penalties, nobody wants to be the one that's on the end of the penalty and be the one that has a breach. And as you described at the beginning of the session, more healthcare entities are being targeted for hacking now than ever before. So it's very important that healthcare providers and business associates as well beef up their systems and make sure they're protected. So with that, I'd just like to say thank you for inviting me to present with you today, and wish everybody a good day. And if you need more information, please get to Brad and HIC Networks. And thank you very much.